Good morning, everybody. I'd like to welcome you to our ongoing AI Med Talks in the context of this major pandemic. And we want to keep moving on the AI medicine agenda because I think as I sit here and reflect on our vision of bringing AI to all aspects of medicine, I think this global pandemic really spells out the tremendous need for our AI partner to be part of our practice. So I have today Susan from VIDA, who actually will tell us about how she and her company in radiology can help with the with this massive pandemic. Susan?
Well, thank you, Anthony. It's thanks for involving me and what VIDA does in your broadcast here. You know, I probably would start off as saying that you can see we're working from home. We're in isolation. I think it's time that we you know, we're in isolation, but we're not alone. And I think that as a community, we get together and determine how best we can, you know, pull our forces together to solve for the greater good. You know, AI in general. So VIDA is a AI and informatics company, and we're focused very specifically on managing the patient with or at risk of pulmonary disease. So very topical right now. Right. And you know, the value proposition that I think we bring, we have in, I think, in normal times are now I think even more important. One is just managing radiology and clinical workflow or patient management, you know, in an infrastructure that's not necessarily aligned or workflow efficient. So that's one area that AI can help. And that's in the best of times, you know, that's in the normal. The new normal is now we've put we're about to put a tsunami of patients into this process that's already has a very fragile infrastructure. That's clearly a way that AI can help. And it can help if it's managing patients with COVID-19 or helping manage the patients in your normal workflow that have to be managed anyway, and improving the efficiencies of those patients so you can free up time for the new influx of patients. So that's
the,
just kind of,
yeah.
Go ahead.
I was just going to say, the U.S. discussion has been on getting testing because that ramps up your diagnosis, but yet the CTs are almost pathognomonic, right, for COVID-19. They have these cavitations in the lungs for bilateral pneumonia. So how do you and VIDA can contribute to that, as well as, I know you talked about workflow, but just the CT itself, especially when we're going into impoverished areas of the world in the near future with South America and then Africa, I think it's going to be very difficult. So you kind of have to do the whole spectrum of support, right, for radiology.
Yeah, I think so. And you know, you know, the most susceptible or vulnerable populations are the, you know, not entirely, but by and large those with, you know, underlying respiratory conditions anyway. So to be able to manage those underlying respiratory conditions and to understand that that is your more at-risk population if they have indicators of COVID-19, I think that can help manage the triage and the workflow for the patients that would go into more critical care scenarios. So these are patients that, you know, we deal with every day. They have much greater risk of, if they do have the virus, that they would be managed or triaged into a critical care facility.
Susan, do you see in the near future that future epidemics can actually be averted by having certain CT scans actually alert the international community that this is a very different kind of pneumonia, and this is something that we should really keep an eye on, especially when it's grouped in a cluster, because I wonder what the whole beginning of this whole pandemic, there was something very different about this pneumonia being bilateral and with some distinguishing features. And I think that's where your company is really, really critical, because the best way to eradicate a pandemic is to start in the anticipation stage, which is even before the containment stage. So I can see
Yeah.
your diagnostic and interpretation actually have a critical role in the future of pandemics.
So I think that the critical piece of your question is in the future. I think as we're getting hit with this first wave onslaught of patients, it'd be very difficult to, put a CT scan in that process now. First of all, you're right. It looks like the patterns of disease are very distinctive, but it's also not recommended now that from the American College of Radiology that is used as a diagnostic tool. Part of it is the number of cases just relative to other diseases. It's just not that great yet. So I look at that, to be able to distinguish, definitively diagnose this disease as to hit what you're calling future in the second wave. I think we'll know enough about what's happening now to be able to incorporate those types of algorithms for the second wave and when there's a recurrence of this virus. I think the first wave, our focus is on workflow and getting patients through as quickly, efficiently, and
I'm actually referring to an imaginary COVID-29 in 10 years, that it could be a scenario that a relatively different kind of CT is actually quickly recognized very proactively. And the suspicion for the beginning of an epidemic should be, raised very, very high. I think in 10 years, CTs will be like chest x-rays. We'll be getting a lot of CTs. And as CTs become more accessible and mobile CTs now for ICUs, I think CTs are going to be the chest x-rays of the future.
Well, I agree with that. And not only the mobility of them, but be able to get the greater information at a much reduced dose, which is always one of the indications for not doing a CT. But we can acquire information at a much lower dose. So in COVID-29, I completely agree that we will have algorithms and support mechanisms to find indicators of this disease early. And because it does have very distinct features, we'll know a lot more, obviously, then, and how we would separate it from other classes of lung disease. But as you know, patients with lung disease often have many, so you have to, it's not just finding one or the other, it's kind of parsing through all the things that are happening there and determining what the disease is and its comorbidities, and those magnify the risk.
Susan, we haven't reached into the international community. I think it's more important than ever before to congratulate some of our Asian colleagues on the success of their public health measures, but at the same time, really think about our European counterparts that are going through the brunt of the pandemic, and then the upcoming pandemic here in the US. Do you have any words of encouragement and comfort for our international community?
Sorry, words of encouragement for
our international community.
Well, from a humanitarian point of view, I think that, like I said, this is where the world gets, very flat and close. I think that we can reach out to the greater communities. We also can learn from them because they've either hit or have been through a first spike. I was very fortunate on Sunday morning, 6 o'clock my time, so that's a commitment in and of itself, but we're able to talk with some of our collaborators from South Korea, from Seoul, and their vantage point, their perspective on how they managed these patients, got through them, and were able to level off the incidence rate of these patients was invaluable to what we were doing. We were with the medical community or at the University of Iowa, and all the docs, they were asking very specific questions on how they manage their patients. And so one of the things you mentioned about CT in the short term was that they wanted to know whether or not they should use a CT now, because in Iowa they're taking a patient through and they have to completely cleanse the CT afterwards, before they bring another patient in. And so that created just yet another workflow issue for managing these patients. And
Yes.
our collaborators from South Korea said, well, because of that, a lot of times we reverted to a chest X-ray instead. So you'll find that the distribution of the disease, you're certainly not going to find the resolution, but that was enough. Probably it wasn't great enough, but enough to manage those patients because just the sheer number that they were having. So
Well, as you said at the beginning, we're all alone together, and I think my important message and takeaway is that this is more than ever. I think AI really needs to be an important part of crises like this, because much of the confusion and chaos can really be mitigated with, I think, really, really smart use of artificial intelligence. So with that, I wish everyone well and safe in this difficult time, and we will talk to you soon. This is Dr. Anthony Chang signing off for today.
Thank you.